feel a pulse, and that's when they stop and oftentimes start CPR. But again, the whole idea is the pulse is a surrogate for blood pressure. And if you can feel your pulse, then typically you have enough blood pressure, still may be very low, but enough blood pressure to perfuse your brain, your kidneys, and other organs. So blood pressure is variable. Follow along here. So it can vary all the time throughout the day. It's never rock solid, one blood pressure. If I were to take my volunteer again and measure it again, it might be a few millimeters of mercury off or different from one moment to a minute to time. It's very common for it to differ from up to 10 to 20 units, again, when measured at different times. So let me ask you a question. Can anybody give me a scenario where the blood pressure would be high?
If you're nervous.
Sure, that's very good. Yep. Excellent, excellent. So that's definitely a time when you're exercising. Let's hope this picture shows up. Let's see. Yeah. So I have a picture here of exercise. Again, you'll bear with me, but when you're exercising, you need to perfuse your organs better because your organs are eating more nutrients, using more oxygen, using more glucose, and so you need to get more blood, so you need to increase your blood pressure. Anybody know a time when the blood pressure is low? Exactly. Hopefully nobody will have low blood pressure in here today. And I had a picture of somebody asleep in the class on their books and stuff. But certainly when we're asleep, the blood pressure is lower. You're in a resting state. You don't need to perfuse your organs quite as much. So it's not as critically important. And actually, as a physician, it's not uncommon when we're overnight taking care of patients for nurses to take blood pressures at night when a person's sleepy or tired, and for us to get phone calls that, oh, so-and-so's blood pressure is really low. And 9 times out of 10, unless it's extremely low, we say, oh, don't worry about it, they were asleep. So it's very, very important, and this is one of the reasons why when we take the blood pressure, that we need to allow the patient to sit in the room, get acclimated, make sure they're not nervous, and get a chance. Many times people are running late for doctor's appointments, so you slap the cuff on them the minute they get in the door, their blood pressure is going to be high because they just ran up 3 flights of stairs. So again, very, very important. Another reason why it's important is to realize that it's variable, so we need to have, before we label somebody with high blood pressure, we need to check it over time. And quite frankly, you have to check it over 3 times in order for somebody to be diagnosed with high blood pressure. All right, let's talk about some of the systems that regulate blood pressure. So just call out some of the systems that you think, some of the organ systems that may be involved in blood pressure. The heart, right? So we can tackle the heart first. Very good, the heart. So what does the heart do? The heart can control blood pressure by increasing your heart rate. So obviously when you exercise, your heart rate goes up and goes fast. And also, the heart can determine what we call the volume or the contractility, how well or how efficiently the heart squeezes, okay? When we're exercising, the heart squeezes more vigorously. The heart is really just a big muscle, so it squeezes more vigorously, can squeeze more blood through, and so that's how we can regulate our blood pressure. So the heart is one important system that regulates blood pressure. Anything else? So lungs, less so. Less so.
What are the other systems?
What else?
No.
Not the pancreas.
I was being funny.
It wasn't funny.
Other organ systems.
I'm very familiar with
Rayon said the
Well, just
kidneys.
name the organs of the body. What'd you say? Kidneys?
That's what Rayon said.
Yes, so kidneys. We'll get to kidneys. That's a very, very good observation. Kidneys arguably are one of the most important organs, probably next to the heart in regulating blood pressure.
the liver.
The liver, not the liver,
No, but
not
the liver.
necessarily, not critically important. So what about one of the big organ system in our body, and it's technical, people don't always think of it as an organ system, but the blood vessels are really, the vasculature are an organ system, okay? And how the blood vessels control How the blood vessels control blood pressure are essentially by determining the resistance. So this gets a little bit into some of the physics here. But the size of the blood vessels is really, really important. And we can regulate the size of our blood vessels. All right? We can regulate them, and also we can do things that leads them to be either wide open or really, really tight. And really, if you look here, and I showed this law called Poiseuille's law, and it's a complicated physics equation. I don't really want you to memorize that. But one thing I want you to realize, though, is that resistance, which is what the blood vessels offer to blood flow, resistance is inversely proportional. Everybody understand that? Inversely proportional to the radius to the fourth power, okay? And what that means is any small change in the radius of a vessel will get amplified because it's to the fourth power, and therefore will make this resistance number even bigger. All right, so it's not a linear relationship. It's to the fourth power. So I brought these toilet tissue tube and a straw, okay, to bring this principle home. All right. If I took this bottle of water and I said, you know what, I want to spray it through these or run it through these two tubes, right? Which tube do you think would have the least resistance or the lowest pressure through it?
The big one.
The toilet paper or the straw?
The toilet paper.
Right, the toilet paper. All right, the radius is bigger, and when you get the smaller radius, you can lead to issues. The other thing to remember is as we get older, our vessels get stiffer, which is another thing that can regulate pressure. I'll talk about that in a second. But as we eat things like McDonald's and high-fat foods and things like that, we get cholesterol and plaque buildup in our arteries. So we take our arteries that are nice and big, like this toilet paper, and over time, we get them narrow, filled with cholesterol and plaque and junk. And that's another reason why blood pressure increases. It also increases with age. The other thing written down here is stiffness of the vessels is very, very important. Let me ask you, if you had vessels that were like lead pipes versus vessels that were like balloons, whose do you think pressure would be higher? The ones with lead pipes or the balloons? Exactly. Lead pipes, you don't have any capacitance to increase, to handle any increase in volume. So that's going to be nice, and it's going to go right through there, and the pressure is going to be really, really tight and within one zone and high. Versus if you have a nice balloon that can take that pressure, you can kind of almost have a little bit of a pop-off valve. As we get older, our vessels become harder and stiffer. All right? Other organ systems, we talked about the heart, we talked about the blood vessel. So the kidneys, somebody said kidneys, very, very good observation. So the kidneys are arguably one of the most important regulators of blood pressure. They're all important, but the kidneys regulate blood by regulating blood volume, okay? And mostly, and it's more complicated than this, but mostly by regulating salt, all right? So the salt that we're worried about, the most abundant salt that we intake and digest is a salt we call sodium. And everybody heard the term, so I don't know if you've covered it yet, but osmosis,
Yeah.
right? So osmosis, you have a penetrable membrane that the solutes can't go through, but the water can go through. So if you have a high concentration of sodium on one side of the barrier and a low concentration of sodium, the water is going to go over to the high concentration to try to get the solute concentrations roughly equal. It's the same thing that the kidney regulates. You ever notice when you're sitting down watching the game or American Idol, whatever it be, and you eat a thing of potato chips, and soon after you're really thirsty? It's that same concept. You just took on what we call a salt load, a lot of sodium. In order to dilute that sodium, your body regulates and says, you know what, I need to drink some water. By doing that, though, you increase your blood volume, which again will lead to higher blood pressure because now the heart has to pump more blood around. In order to do that, it has to increase the pressure. Yes?
Is low blood pressure called hypertension?
Exactly. Hypertension is high blood pressure. Low blood pressure is called hypotension. Exactly. So again, the most important thing, what the kidneys do is regulate salt. They either hold on to salt when you're dehydrated, or they actually get rid of salt. Things like Gatorade also help those electrolyte balances. Gatorade actually has a fairly high amount of sodium in it that holds it so that, because when you sweat a lot, you lose sodium salt that way too. All right, any questions on that? All right, so the other systems, all right, are the brain and the nervous system, all right? So the brain releases hormones in response to your blood pressure, and it releases hormones that regulates these other organ systems, such as the kidney, the heart, and the blood vessels. The brain can tell the kidney to spill sodium or actually hold on to sodium. The brain can tell the heart to go fast or slow down. The brain can tell the blood vessels to either get smaller in size or get bigger in size. And then the nerves, obviously, the brain doesn't work isolated. The brain transmits these signals by either one, releasing factors into the bloodstream, or two, by actually directly innervating these blood vessels, or innervating these organs like the heart, the kidney, and the blood vessels. All right? All right. So, hypertension, and the exact numbers aren't critically important, but what I had here was a slide talking about how we define what constitutes hypertension or high blood pressure. So hypertension is blood pressure that is out of the normal, okay? A normal blood pressure is any blood pressure with a systolic number less than 120 and a diastolic number less than 80, okay? So 120 over 80, that's the number that you need to really know, yes?
Would that be like a number specific for all people of everybody type, or would it differ from person to person?
So obviously blood pressure differs from person to person. The JNC7 was a group of really prominent physicians who essentially sat in a room, reviewed all the research that had been done on blood pressure, and based on that research determined what would be the ideal blood pressure, okay? So your answer to that is yes, everybody, every adult should have a blood pressure greater than or less than 120 over 80, okay? So it doesn't matter, body type, body size, age, it doesn't matter. The ideal pressure should be 120 over 80 or below, okay? Yes.
So like, do you have a range where you can like say that they have hypertension? Because like if it's like 130 over 90 or something, well, does the systolic and the diastolic number both have to be high? Or
So it's a good question. I'm glad you asked it. Just one of either the top number, the systolic number, or the diastolic number. So if the top number is 115, but the bottom number is 90, that we would call that high blood pressure, okay, or hypertension. So just one number has to be out of the range. So you need both numbers to be below 120, the top number below 120, the bottom number below 80. And then what they broke down is this group of doctors, very smart, sat down over a whole week actually and came up with this. And they meet every few years because the numbers may change, new research may come out. But they came out with other categories, one category being what they call pre-hypertension, which is when you're in that number between 120 and 130, and that diastolic number is between 80 and 89. And then they broke it down even further into stages of hypertension called stage 1 and stage 2, and those are even higher numbers. Those numbers, stage 1 is 140 to 159 systolic, and diastolic between 90 and 99. And stage 2 hypertension is anything over 160 and a diastolic over 100, all right? So bottom line is, though, is that the numbers you want are less than 120 over 80. And a group of people sat down and came up with what these numbers should be. The clinical diagnosis, again, needs to be a blood pressure taken correctly, which is a critical point, which we talked about, on multiple occasions, meaning 3 times. All right. So if you came in my office the first time I saw you and it was high, I probably would say, hey, watch yourself and other things. But if on the 3rd visit every time I checked it, it was high, I would tell you, you have high blood pressure, and we need to do something about it. We can talk about some of those things too. Yes?
How is it possible